Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Check out our brand new app and get access to our new pharmacology and med-surg mastery courses. Join for free. Click the link in our description below. All right guys, let's begin. We're highlighting only the need-to-know stuff for the NCLEX. But first, we're going to do a quick recap to reinforce the highly tested key numbers. So, key numbers here. 2 to 3 INR for warfarin. Antidote again was vitamin K. So the memory trick, warkin. So warfarin, vitamin K, and in for INR. Just think warkin. And you wonder if it's working since it takes 5 days to reach full effect. Next is 46 to 70 APTT for heparin with the antidote protamine sulfate. So the memory trick was hepit, like the frog. H for heparin, P for protamine sulfate, and PTT for hepit. And since heparin acts fast, just think the frog jumps really fast. Lastly, 150 to 400 platelets. Look for the P's, guys. So aspirin, clopidogrel, and enoxaparin or enoxaprin. Guys, P for platelets. The key number here is less than 50 gets really risky. Guys, thrombocytopenia is 50,000 or less. So we even hold any type of heparin. Now for patient teaching, the big contraindication here, and to be honest, for any blood thinner, is key term active bleed, like a peptic ulcer or peptic ulcer disease. And we always avoid any patients with liver problems since the liver makes coagulation factors. So we use the acronym CHANT. C for cirrhosis, H for hepatitis, A for alcohol. Key term on the HESI was a client just drank 6 beers. N for NSAIDs, and the ATI loves to name naproxen and ibuprofen. And T for Tylenol overdose, leading to liver damage. Now we monitor signs of bleeding and we notify the HCP ASAP. Keywords used on ATI was black tarry stools, usually indicating a GI bleed, hematuria or blood-tinged urine, epistaxis or nosebleed, and even petechiae on the chest, mentioned by HESI, and easy bruising. Now supplements to avoid completely. No Eggos, guys, like that old waffle commercial. Lego my Eggos. E for vitamin E, G for ginseng, ginkgo biloba, and garlic, and O for omega-3s, and the S is for St. John's wort. Lastly, we avoid trauma, so the big key terms used on the HESI. No small rugs or dim halls. Always well-lit hallways. No brushing hard, we use a soft bristle toothbrush. No flossing. No alcohol-based mouthwashes. No razors, only electric shavers. No constipation, only fiber and fluids, guys. And no contact sports. And we always wear a medical alert bracelet. Now, 3 common test questions. Number 1, when do you hold heparin and contact the HCP? Select all that apply. So guys, heparin, just think hepit. We're looking for PTT between 46 and 70. Anything north of 70, we gotta call the doctor. So patient has recent diagnosis of peptic ulcers. So we're gonna be holding that medication. Number 2 is patient has a PTT of 105. Guys, that's way north of 70. What about option 3? Patient has an INR of 4.5. Nope, that is warfarin, not heparin. How about 4? Patient has black tarry stools. Yes, that could be indication of a GI bleed. And patient has a PTT of 25. Well, that's under 46, so just keep on giving the heparin for sure. And lastly, patient is taking ginkgo or vitamin E. Guys, definitely hold the medication. Huge risk for bleeds. Now, question number 2. When do you question the order of aspirin or clopidogrel? Well, guys, the P for platelets, we want it to be over 150. So aspirin and clopidogrel for platelets. So option 1, now the patient has 65,000 platelets. Guys, that's way less than 150. so it's very iffy. Number 2, patient with 1.5 INR. Number 3, the patient with 46 PTT. Again, that's heparin with hepit, the frog, so no, not a platelet thing. Number 4, currently taking warfarin. Yes, guys, we want to hold this medication because we don't mix aspirin or clopidogrel with an anticoagulant. And number 5, regular consumption of 6 glasses of wine per night. Guys, we're not doing alcohol for sure. And lastly, another common question. A patient on dabigatran for AFib, which action should the nurse initiate? So guys, number 1, place an IV line. No, we're not trying to place an IV line here. We indicate a big bleed. Number 2, report stools that are black and tarry. For sure, that's a GI bleed. Number 3, teach the patient to avoid clopidogrel. Most definitely. Number 4, administer aspirin instead. No, big no-no, we do not mix. And number 5, teach the patient to stop taking this med before surgery. For sure, definitely want to do that. All right, guys, that wraps it up for our blood thinners. Thanks so much for listening, and don't forget to take your quiz. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.